Hey everyone, good afternoon. Thanks for joining us in this Asian Lung Cancer Symposium. Together with us today are three faculty experts from three different departments. Department of Cardiothoracic Surgery, Department of Radiology, and Department of Epidemiology and Statistics. Dr. Johannes Kratz has worked diligently with me to put this lung cancer symposium together. Thank you, Dr. Kratz. And he'll be introducing the speakers today. And I'll help to do the Cantonese lecture. The agenda today covers two main topics. The first one is Dr. Chang talking about some statistics and the hidden health disparity in the Asian community. And then Dr. Alika will be talking about the lung cancer screening, specifically in his department, doing the low-dose CT scans. This is part one of two-part symposium. So the moderator today for the symposium is Dr. Johannes Kratz, who is an accomplished assistant professor of the Cardiothoracic Surgery Department. He is also the Van Auken Endowed Chair in Thoracic Oncology and Director of Advanced Minimally Invasive Thoracic Surgery. 大家好，多謝你哋今日參加今日晏晝呢個亞裔肺癌研討會。今日同我哋一齊嚟嘅咧係有三個部門不同嘅專家嚟嘅醫學專家，一個就係心胸外科嘅醫生啦。一個咧就係放射科嘅醫生啦，另外一個咧就係流行病學同埋統計科嘅博士。Dr. Kratz 嘅中文名咧就叫做季祖詒，季醫生咧就同我一齊咧就籌備咗呢個肺部研討會好耐下噶啦。咁我好多謝佢嘅合作啦。咁今日介紹嘅佢今日咧就嚟同我哋介紹今日嘅演講者嘅。咁咧我咧就用粵語同你哋翻譯啦。咁今日嘅議程咧就主要係包括係兩部分啦，一個部分咧就係講嗰啲亞裔患肺癌嘅機率嗰啲嘢啦，另外一個咧就係講點樣先至查到自己有肺癌咧。今日嘅講座咧就只係呢個肺癌研討會嘅兩部分其中嘅第一部分。咁咧，所以我哋而家咧就事不宜遲，將呢個研討會咧就交俾季醫生咧嚟介紹我哋今日嘅第一位嘅演講者。So without further ado, I'll turn over to Dr. Kratz to introduce our first speaker today.
Thank you very much, Diana. I really appreciate being here. I'd like to welcome everyone to the Asian Health Institute seminar on lung cancer. I'd like to introduce Dr. Iona Chang. She's a professor in the Department of Epidemiology and Biostatistics at UCSF. She is a cancer and genetic epidemiologist, and she's the principal investigator of multiple NIH and foundation-funded projects. These projects include the Bay Area Cancer Registry, and other projects that examine genetics, lifestyle factors, and neighborhood characteristics in relation to cancer risk. She has many projects that are centered around understanding cancer risk in Asian Americans, especially in never smokers. And I am the proud collaborator of one of these projects that examines susceptibilities of Asian Americans in relation to lung cancer risks. She's going to speak to us today about lung cancers in the Asian American population, and especially the risk of never smokers who develop lung cancer.
季醫生咧，而家咧就介紹第一位演講者咧，就係鄭嘉怡教授。咁鄭教授咧就係呢個流行病學同埋呢個生物數據學嘅教授嚟嘅。咁佢亦都係呢個癌症流行病學嘅主任，同埋係加州大學舊金山分校嘅一個教授。咁鄭醫生咧係有幾個國家研究會嘅資金去幫助佢去做研究嘅，咁佢係一個非常之資深嘅研究員啦。咁佢嗰啲研究咧係包括不同嘅嘢啦，有啲就係研究環境嘅嘢啦，有啲係研究個人嘅生活嗰啲嘢啦。咁即係總之佢做嘅研究咧主要咧都係同癌症有關嘅。咁佢有啲研究，大部分嘅研究咧都係同呢個亞裔嘅癌症咧係有關嘅，尤其是係嗰啲從來冇吸煙嘅人。季醫生咧都其中一個同呢個從未吸煙嘅有肺癌嘅研究咧，佢亦都係喺裏邊有幫手嘅。咁佢今日講咧就係講一啲亞裔嘅肺癌嘅情況啦，尤其是係嗰啲冇吸煙嗰啲人。
Thank you, Dr. Chang. Welcome.
我哋多謝鄭教授。
Thank you. Thank you for that very nice introduction. I'm really happy to be here today. So first, I want to start with pointing out the importance of lung cancer as it's the leading cause of cancer mortality among Asian American population groups. So what this figure is showing here is that among males, looking at the top 5 leading causes of death among Asian Indian, Chinese, Filipino, Japanese, and Korean and Vietnamese men. And what you can see here is that lung cancer is a leading cause of death across all of these 6 Asian American ethnic groups.
咁啊，鄭醫生咧就呢個圖表好似好多嘢咁，但係你主要嚟睇咧就係睇下上面嗰度寫咩人嚇。咁咧有印度人、中國人、菲律賓人嗰啲啦，咁啊總共有5個、6個主要嘅亞裔嘅族裔嘅。咁咧，但係你睇下邊個係第一個頭號殺手啊？係肺癌喎。所有嘅亞裔嘅族裔裏邊，通通都係肺癌係一個頭號嘅殺手，即係喺癌症裏邊之中咧，肺癌死嘅人咧係最多嘅，嗰個就係男性啦。
And similarly, when we look at females across Asian, Indian, Chinese, Filipino, Japanese, and Korean and Vietnamese ethnic groups, we do see that you can see for Chinese, Japanese, Korean, and Vietnamese females that lung cancer is a leading cause of death. It's the second leading cause of death among Filipino women and the third among Asian Indians. So this definitely is an important cancer that is experienced by Asian American populations, both males and females.
咁各位正話再提一提就係正話睇嗰張咧就係男性噶啦，就肺癌係頭號殺手啦，唔理你邊個族裔係咪？咁咧但係依個咧就係女性噶啦。咁女性嚟講咧就唔係個個都係肺癌係頭號殺手嘅，但係中國人係喎，6個族裔之中咧有4個都係頭號殺手咯喺女性嗰度。
So what do we know of what may be some of the signs and symptoms of lung cancer? And this comes from the American Cancer Society. So some of the common symptoms include a cough that does not go away or gets worse, coughing up blood or rust-colored sputum, chest pains that is often worse with deep breathing, coughing, or laughing, hoarseness, loss of appetite, unexplained weight loss, shortness of breath, feeling tired or weak, infections such as bronchitis, pneumonia that doesn't go away or keep coming back, and new onset of wheezing. So these common symptoms, they can also be caused by other things outside of lung cancer. But what's important is that if you're experiencing problems, to really talk to your doctor. It's very important if we are seeing some signs, if possible, to identify lung cancer earlier.
各位睇到而家呢張圖片咧，就係話呢啲係我哋常見嘅肺癌嘅症狀啦。但係好多時肺癌咧初期咧係冇症狀嘅，到有症狀嘅時候，如果到吐血嘅時候啊，咳到吐血嘅時候咧，已經係好末期咯。所以我哋其實就係希望你哋，而且你睇呢啲症狀咧，食慾不振喎，攰喎，成日都有發生噶啦，係咪？咁所以咧，你哋如果係覺得個身體有變化，最近有變化，譬如突然間把聲沙咗，譬如突然間唔見咗，即係突然間減輕咗體重喎，你唔係話食嘢少咗，但係嗰啲體重係減輕咗10幾20磅嗰啲，喺嗰個短時間之內，或者係咳啦，成日咳啦，或者係會咳出血啦，或者個呼吸覺得係有困難啦，係咪？咁咧就同埋成日有新發作嘅氣喘，你覺得個身體有咩變化？你覺得係有啲唔妥嘅時候咧，最好就係去睇醫生咯，因為你又唔知嘅，個醫生都唔知嘅，佢都要同你做檢查先知嘅，係咪？但係你一定要早啲去，因為咧早發現就可以早治療，咁咧個死亡率咧就會降低咗好多噶啦。
So there also are some signs and symptoms in regards to whether lung cancer has spread to other parts of the body. And so this could be experiencing bone pain, such as pain in the back or hips, nervous system changes, such as headaches, weakness or numbness of an arm or leg, dizziness, balance problems, or seizures. And this is from when the cancer could spread to the brain, yellowness of the skin and eyes, jaundice from cancer that spread to the liver, and swelling of the lymph nodes. This is a collection of immune cells, such as those in the neck or above the collarbone. And so for lung cancer, what we really are faced with the challenge is, unfortunately, it often presents at a very advanced stage. So these are some of the signs and symptoms. And again, I think we'll talk about this later, really the importance and what we're learning in regards to screening for lung cancer.
咁咧其中嘅最大問題咧，就係呢啲肺癌咧，佢會轉移啊， 當佢轉移到身體各個嘅部位嘅時候咧，咁嗰啲部位咧就會有症狀出現嘅啦。譬如好多時嗰啲肺癌就移咗去個脊骨啦。如果移咗去脊骨嗰度咧，或者係嗰啲骨嗰度咧，咁就開始啲骨會痛啦。或者咧，有時去個頭喎，個肺癌會走咗個頭嘅。咁咧，如果走咗個頭咧，咁個頭有關頭個大腦嘅嘢咧就會出現啦。譬如頭痛啦，手臂啊、腳啊咁咧就冇力啦、麻木啦，行路有問題啦，個平衡係嘛？咁或者有時咧就會抽筋嘅。咁如果移植咗，如果嗰個肺癌係移咗去嗰個肝嗰度，咁嗰啲肝嘅症狀咧就會出嚟啦。譬如會即係嗰啲皮膚啊或者嘅眼白嗰度咧就會變黃啦，係咪啊？嗰啲尿咧又會變得好深色啦。咁咧或者如果係去到嗰啲lymph node 啊，咁嗰度咧，如果係去到嗰啲咁嘅淋巴嘅結嗰度咧，咁佢就會腫啦。嗰淋巴結腫嘅時候咧，就會 block 住嗰啲血咧，就個血嘅循環又唔好啊，咁樣咧，就會有其他嘅症狀出現啦。咁啊，即係可能部分嘅身體會腫啦咁。咁所以咧就係睇下嗰個肺癌咧有冇轉移到。如果佢係轉移咗去咗其他嘅器官嘅時候咧，咁咧就會多咗好多症狀出現嘅。
So we do know what some of the risk factors for lung cancer are, and clearly I think everyone is aware that tobacco smoke is a cause of lung cancer. It contributes to 80 to 90% of lung cancer deaths. Other risk factors include secondhand smoke, exposure to radon, exposure to asbestos, other cancer-causing agents that occur in the workplace. Certain dietary supplements have been identified as risk factors, arsenic in drinking water, previous radiation therapy to the lungs, air pollution, and family history of lung cancer.
咁我哋好多時就話點解嗰個朋友我哋識嘅佢會有肺癌咧？佢有咩危險因素令到佢有肺癌？佢係咪應該一早嘅時候應該自己知道嘅咧？咁我哋據我哋所知咧，就係大部分嘅肺癌嘅原因咧，就係因為食煙嘅，同個食煙有關嘅，唔係自己食煙就係食二手煙。咁你睇到自己食煙嘅情況咧，如果你係食得煙多咧，咁咧有喺個肺癌裏邊咧，係會導致8-9成嘅人咧係會因為肺癌而到死嘅 ，OK？ 咁咧就或者係呢個接觸石棉啊、氡啊，或者係一啲環境污染嘅嘢啊，或者甚至食一啲營養嘅補充劑咧，係可以致癌噶，或者係水裏邊有啲砷啊，或者係個肺部咧，如果係做一啲放射性嘅治療咧，有時都會令到你有癌嘅喎。咁咧就空氣污染我哋知啦，咁。仲有一個咧就係家族嘅歷史啦。如果你屋企嗰度有家人有個肺癌咧，呢個係一個大嘅警惕嚟嘅。
And so our research group is really interested in trying to understand the incidence rate of lung cancer. So these are the number of new cancer cases that develop during a period of time among females who never smoke across specific race ethnicity groups. And this question came about because in partnership with clinicians who were seeing that there were actually they were observing more Asian American females who never smoked with lung cancer, but there was not yet at the time data to really document what were the statistics, what were the numbers behind that. And so we conducted this study where we were able to use information from electronic health records across California and Hawaii. We were specifically picking areas where there's a larger population groups for Asian American and Native Hawaiian Pacific Islanders. And so this figure, what it's illustrating here, so these are the age-adjusted incidence rates, so the number of new cancer cases that occurred during the specific period of time. What you'll see to highlight in this animation is that across Asian American, Native Hawaiian Pacific Islanders collectively as a group, also looking at distinct Asian American and Native Hawaiian Pacific Islander groups, almost all with the exception of Japanese Americans, so those all in the red box, have a much higher incidence rate of lung cancer in comparison to non-Hispanic whites. You can see that's age-adjusted incidence rate of 10.1. And so, for example, if you look at Chinese Americans, they have about a 2-fold higher incidence rate of lung cancer among females who never smoke. So that's 22.8 in comparison to 10.1. So this was the first time that we actually had data to show that Asian American, specific Asian American and Native Hawaiian Pacific Islander groups had a much higher burden of lung cancer among females who never smoked.
但而家呢個咧就係我哋好多時都知道喺我哋嘅親戚朋友之中咧，曾經係有一啲婦女佢又冇食煙，但係佢又得咗肺癌嘅。咁點解會咁多人有咧？咁到底又有幾多呢人咧？咁呢個咧就係 Dr. Chan 鄭醫生佢係做咗呢個研究咧，就同嗰啲白人比較。咁到底華人、菲律賓人、印度人或者係其他嘅亞裔啦，咁咧佢咧就比較咁到底同白人比係點樣比咧？咁咧而家呢個表咧就好似天方夜譚咁咧，你睇到。但係簡單嚟講嘅咧，你就睇下呢個數字。呢個數字咧就有幾多人得到呢個肺癌？呢個肺癌咧就係每10萬人之中嘅發病率就有10.1個。OK， 呢個就係白人。咁唐人係點咧？唐人咧就比呢個咧係咪多咗1倍啊？有多啊？因為你10萬人之中佢又有10個，我哋有22.8個，成23個係咪啊？即係全部咧美國亞裔嚟睇咧，即係唔好分係邊個嘅亞裔啦。總括嚟講咧，平均嚟講咧就係亞裔咧就係有17.5個人，就係呢個17.5個人。係每10萬人之中有17.5個人係有呢個肺癌嘅，而呢啲咧就係冇食煙嘅人嘅肺癌。咁所以咧，當然有食煙嘅人就比呢個 number 高好多啦，係咪？但係冇食煙嘅人咧，佢都有啲咁嘅 number， 但係呢個 number 咧係離奇咁樣比呢個白人咧係高咗好多出嚟嘅。咁呢個就係佢想帶俾你嘅消息啦。咁所以你見到呢度咧。呢個紅色呢個 box 嗰度咧，你見到嗰啲點咧，通通去晒呢邊嘅，即係佢係多過白人嘅，因為白人喺呢度啊嘛，佢係比白人多咗出嚟嘅。佢白人呢邊喺度，其他嘅亞裔咧就走咗嚟呢度。唯一比白人少嘅咧，就係美國嘅日本人，唔知點解嚇，但係佢哋咧就係比白人係少啲嘅。
So we are really interested to try to understand what may be some of the risk factors in which Asian American females who never smoke experience lung cancer. And we know from studies in Asia that risk factors such as air pollution, cooking oil fumes, secondhand smoke, which actually the prevalence of that is higher in Asia. It still occurs in the US, but at lower levels. So our question is to try to understand what are some of the known risk factors. Do we see the same association here in the US among Asian American females, as well as what may be some other risk factors that we could identify. So currently we are conducting the FAN study. This is a female Asian never smoker study. It's in collaboration with UCSF, UC Davis, and Stanford. It's led by myself, Scarlett Lynn Gomez, and Moon Chen, and it's funded by the National Institutes of Minority Health and Health Disparities. So this is the first study looking at Asian Americans specifically in regards to lung cancer etiology.
咁咧，鄭教授咧，呢個鄭教授啦嚇，咁咧就係同埋陳兆昌教授同埋林思嘉教授咧，呢3位咧就係主要嘅做研究嘅主導嘅3位教授。咁咧呢個就係全美國第一個係睇亞裔點解係冇食煙嘅亞裔係會有呢個肺癌嘅第一個嘅研究嚟嘅。咁咧呢個研究咧就包括咗我哋 UCSF 啦，鄭教授同林教授咧就係 UCSF 噶啦，陳教授咧就係 UC Davis 噶啦，咁仲有另外一位教授咧就係斯坦福大學嘅。咁即係由依間3間大學咧夾埋一齊做呢個研究，咁咧就係想揾出係咩原因啊？呢啲冇食煙嘅人。或者佢有食二手煙啦，或者空氣污濁啦，諸如此類啊，或者油煙多啦，但係到底係乜嘢嘅原因令到佢哋會有肺癌咧？咁呢個研究咧就係由呢個國家少數民族健康差異研究院所資助嘅，咁即係政府俾錢啦嚇。
So this is our study team. Actually, we have a growing number of collaborators in addition here at UCSF, UC Davis, Stanford, and we work closely with our community patient and advisory committee, who really helps us in terms of reaching out to the Asian American communities. Also, our patient advocates help us in terms of thinking about some of our questionnaires that were asking us and giving us insights about their perspective. So this is just includes, we have interviewers in multiple languages, epidemiologists, and a whole host of study teams. Some of them are illustrated here.
咁呢個研究咧係相當龐大嘅，個研究團隊咧都係相當龐大嘅。咁啊有不同嘅語言嘅人士嚟到擔當去做呢啲問卷調查啦。咁咧就係正話講過啦，就係主要係3間大學啦嚇，我哋加州大學舊金山分校加州大學戴維斯分校同埋斯坦福大學。咁咧仲加埋咧就係社區嘅人士啦，社區同埋呢個患者諮詢委員會，呢個係非常非常之重要嘅，因為好多喺社區工作嘅非牟利人士啊，或者嗰啲病人啊，甚至佢嘅家屬啊，咁咧就可以做一個諮詢委員會幫我哋呢個研究嘅。
So the aims for our study are to identify attributable risk of known, putative or suspected risk factors for lung cancer among Asian American females who never smoked. We'll look at genetic ancestry, as well as individual level exposures or potential risk factors. In addition, we're interested in neighborhood factors, including the social environment and air pollution, and also with lung tumors, we'll characterize their mutations and look at the relationship between individual neighborhood risk factors with these mutational profiles of their lung tumors.
咁佢調查啲咩咧？佢主要咧就係查幾樣嘢嘅，一個咧就係即係調查嘅對象就係從不吸煙嘅美國亞裔女性啦。咁咧查佢哋啲咩咧？查佢哋嘅祖先嘅遺傳啦，即係以前爸爸媽媽啊、家族啊有冇人有過呢個肺癌啦？或者個人嘅暴露風險，即係譬如你喺嗰啲地方做嘢好大風塵啊，即係自己係會有呢個染上肺癌嘅風險啦。咁咧另外咧就係睇下個環境啦，你住嘅環境啊、做嘢嘅環境啊，咁咧有冇一啲空氣污染啊或者環境污染嘅因素啦。咁咧仲有一樣嘢咧就係呢個我哋用佢嘅電子嗰個病歷表咧，就睇下佢嗰個，如果呢啲人已經有咗肺癌咧，咁我哋知道佢係咩肺癌啊嘛，有咩嘅基因突變啊嘛，咁啊同佢將佢呢個咁嘅特徵咧，就將佢連埋佢嘅個人嘅環境啊嗰啲風險因素咧，就睇下查唔查到啲咩關係出嚟。咁呢個係一個相當仔細嘅研究嚟嘅。
So we are recruiting participants for our FAN study. We are looking for 600 women with lung cancer, as well as 600 women without lung cancer. These are of all Asian American ethnic groups. And we will ask them to complete a survey. And this can be administered by phone, online, or paper. And it will ask about questions about secondhand smoke, cooking oil fumes, health behaviors, prior lung diseases. And some of these questions we really want to be able to ask across what we call the life course. So experiences as childhood, as young adults, as adults. We will also be asking for a salival sample. This is what we'll use to be looking at DNA and genetic ancestry. And then for those with lung cancer, access to the tumor tissue. These women were recruiting from the greater Bay Area. In addition, we've extended our recruitment to both the Los Angeles, Orange County, and Sacramento area as well.
佢而家呢個研究咧，主要嚟講咧，就係分開兩邊嘅，一邊咧就係有肺癌嘅婦女，一邊咧就係冇肺癌嘅婦女。咁咧聽鄭教授講啦，就冇肺癌嘅婦女嗰一邊咧就已經揾夠人噶啦，但係有肺癌嘅婦女嗰邊咧就未夠人嘅。佢呢兩組人咧，每組人咧係想揾600個。咁咧揾咗之後，佢哋要做啲咩咧？第一個就係問卷調查啦。第二個咧就要俾啲口水樣本，咁呢個都好容易做嘅，問卷調查咧電話同你講嘅啫，咁或者係上網做嘅啫。咁口水樣本又好容易咧寄嘅啦嚇，佢寄個嘢俾你，你咪寄翻俾佢。咁第三個咧就係，如果嗰個係婦女係有肺癌嗰邊嘅咧，咁咧我哋咧就會係同佢個醫院啦，因為佢有肺癌咧，佢一定有個抽咗呢個樣本嘅，咁咧我哋就會同佢攞個嗰個腫瘤嘅組織嗰個樣本多少少嚟睇下佢嗰啲基因係點樣突變。咁呢個咧就係通通都係唔需要嗰個患者係自己親身嚟嘅咯。
So this is our website for our fan study, and I encourage those who are interested to learn more about our study. It's fanstudy.ucsf.edu. There's a really nice video that's played there that can describe what we're asking of the participants. In addition, there's information to contact us, and this information is in English, Chinese, Tagalog, and Vietnamese.
咁咧就請大家咧留意呢個網址，就係叫做 fanstudy.ucsf.edu。你入咗呢個網址裏邊咧，就會有好多資料關於呢個研究噶啦。
So I encourage everyone to get engaged. I think it's really important that we spread awareness about lung cancer in Asian American, Native Hawaiian, Pacific Islanders, and females. Also to share the word about our fan study, and then to be aware of things that individuals can do to reduce their risk. So that is avoid smoking, avoid secondhand smoke, as well as avoid cooking oil fumes.
咁我哋當然係希望大家幫手去盡量幫到呢個研究啦，因為幫到呢個研究即係幫到我哋自己，因為我哋咁樣就會大家明白啲係乜嘢情況之下，就算唔食煙啊，都可能有呢個肺癌嘅風險，係咪啊？咁所以啦，我哋最好咧就可以幫下佢哋手，就睇下或者親戚朋友之中啊，或者識嘅同事之中啊，有邊個係有肺癌嘅，但係佢未參加呢個研究嘅，咁啊叫佢去上嗰個 Fan Study 嗰個 website 嗰度去睇下可唔可以打電話啊，或者係用電郵啊，同嗰度同即係呢個研究嗰啲人員去嗰啲協調員去接觸咯。咁然後咧就呢個就係嗰個 website 啦嚇 fanstudy.ucsf.edu。咁然後咧我哋亦都希望大家咧就而家我哋即係有少少嘅眉目，大概喺度嚟到懷疑緊有啲嘢嘅，懷疑緊咧就係譬如人哋食煙啊、二手煙啊嗰啲嘢咧係可能有問題咯，或者係油煙啊可能有問題咯。咁所以咧即係個空氣通風啊，避開嗰啲食煙嗰啲人啊。同埋煮嘢食嘅時候小心啲啊，唔好企到咁埋，唔好吸咁多油煙啊咁呢啲嘢咧係我哋可以自己做得到嘅。就算而家個研究未做到出嚟，我哋自己都可以避免，唔好等到即係自己驗上有呢個肺癌，係咪？即係我哋唔知係咪，但係有咁嘅可能。咁係咪就要等個研究出咗嚟先知啦？
So I'd just like to thank all of our investigators contributing to this work and the opportunity to share with you the importance of lung cancer among Asian American population groups and our fan study. So thank you.
咁多謝鄭教授，佢即係佢再 show 多一次，就係其實都有好多大學嘅，咁同埋Kaiser而家都有幫嘅，嗰啲有啲醫生喺Kaiser嗰度係幫啲揾啲病人俾佢嘅，咁就佢係多謝所有嘅研究嘅團隊同埋所有合作嘅人士。Thank you.
Thank you very much, Dr. Chang, for that great talk. And thank you for the service you're providing to the Asian American community and the Asian community worldwide through your research.
Dr. Kratz 咧就貴醫生咧就再多謝一次鄭醫生。
So now I'd like to introduce Dr. Elicker.
咁而家佢就介紹Dr. Elicker。
Dr. Elicker is a professor of radiology and the chief of chest radiology at UCSF.
咁Dr. Elicker 咧就係我哋呢個放射科呢個裏邊一個教授啦，亦都係呢個小心肺呢個部門嘅主席嚟嘅。
He earned his medical degree from New York Medical College and completed his residency at Yale.
咁咧佢係喺紐約嘅醫學院嗰度畢業啦，咁然後咧就喺耶魯嘅醫院嗰度咧就係做住院醫生嘅。
He then did his fellowship in chest radiology at UCSF and stayed here after joining the faculty in 2006.
咁咧Dr. Elicker 咧就跟住咧就嚟咗呢個加州大學三藩市分校咧，就做再深入咁樣去做呢個醫生，呢個放射科嘅醫生。咁然後咧就完咗之後咧就留咗喺呢度繼續做，2006年做到而家啦。
He is now the chief of chest radiology at UCSF.
咁佢而家就喺胸肺部嘅放射部門嘅主任啦。
His research interests include high-resolution CT, imaging in patients with lung transplants, and thoracic vascular imaging.
咁佢係有不同嘅研究喺度進行緊啦，主要都係同呢個 電腦掃描有關嘅啦，或者係同呢個肺移植之後嗰啲照射啊係有關嘅。
His topic for today that he's presenting on is lung cancer screening.
咁佢今日講嘅咧就係講邊個應該做肺癌篩查。
Thank you, Dr. Elliker, and welcome.
咁多謝。Thank you, Dr. Kratz.
Well, thank you so much for having me. I'm a radiologist. I look at images, I look at x-rays, I look at computed tomography or CT, and I look at MRIs or magnetic resonance imaging. So I'm going to be talking about lung cancer screening and the images.
Dr. Elliker 咧，佢咧就係主要就係對呢個放射科嘅不同種類型嘅放射科嘅影射嘅形象啊，係做研究嘅，同埋呢個係佢嘅興趣。
If you look at the causes of death in the US over time, the percentage of deaths caused by heart disease has gone down significantly, but pertinent to today's talk, the percentage of deaths caused by cancer has gone up. So we hope to develop ways of detecting cancer early when it's more treatable.
咁咧，大家睇下呢幅圖咧，大概都睇到個意思噶啦。因為一個咧就係1971年嘅，呢個批就係1971年嘅，呢個就係2011年嘅。你睇到呢個心臟科咧就係由38% 咧就跌到24%，即係心臟科由心臟病而死嘅人咧係大大降低咗嘅。但係相對嚟講咧，呢個癌症咧就大大增加啦，由19% 增到23%，增咗4%。
If you look specifically at lung cancer, it is one of the most common cancers, and it is the number one cause of cancer-related deaths. So again, it's really important to be able to try to identify lung cancer early when it's more treatable and where we can prevent people from suffering from it.
咁大家睇下呢張圖片啦，嗰啲 number 啦，你都睇到個由肺癌而致死嘅人係非常之多嘅。咁啊喺所有嘅 cancer 拉埋嚟講嘅時候咧，乳癌就係第一啦，但係咧呢個肺癌咧就係第二嘅，係第二多人嘅。
And one way we can possibly do that is with x-rays. And this is just shows you how we do x-rays. There's a camera which shoots out x-ray photons. They go through a patient. Some of those photons are absorbed by the patient and others go through the patient and then they hit a film. And that's basically how we make an x-ray.
呢個就係我哋成日都去照 X 光，但係都唔明白點樣做影到啲咁嘅相出嚟嘅。咁佢話咧 X 光咧原來咧就係用一種光咧叫做 photons 嘅。咁嗰啲 photon 咧就由一個機發射出嚟嘅，就係呢個機啦。咁咧呢個機發射出啲 photon 出嚟咧，就由綠色嘅框咁樣睇到啦嚇，啲 photon 咁樣穿過人呢個身體咁，然後咧穿過咗之後咧就去到呢張膠片嗰度。呢張咧就係我哋所見嘅 X-ray 膠片啦。
And this is what we get. It's a picture of your chest. And there's a lot of complex anatomy that's shown here, but it's just on one simple film. So x-rays are very good for screening for things like pneumonia, but it's very difficult to pick up cancers early. And it's even some large cancers are difficult to see on x-ray.
咁大家見到咧，呢個就其實係一張平面圖嚟嘅。係二維嘅平面圖，咁你見到咧就係好多嘢咯，又見到啲胸骨啊，又見到個心臟喺中間嗰度啊，又見到條脊骨啊喺後邊嗰度啊，咁係好多嘢嘅，咁啊好多白色嘅嘢咁，所以咧呢啲咁嘅圖片咧最容易睇咧就係睇下有冇肺炎，因為肺炎嘅時候咧黑色嗰啲地方係變咗白色嘅，咁啊好容易睇到。但係除此之外啊，如果要嚟睇呢個肺癌嘅話咧。咁你如果嗰啲肺癌嗰粒嘢喺嗰啲白色嘅堆嗰度啊，咁你好難睇到佢嘅喎，係咪啊？
A much better way of finding lung cancers is something called computed tomography or CT, and it uses x-rays similar to an x-ray machine, but instead you lay down in a machine, the camera rotates around you, and at the opposite side, the x-rays are sensed by the detectors, and it uses a mathematical formula so you can actually see inside the body.
呢個咧就係我哋嘅計算機斷層掃描，就叫做 CT 啦。OK， 咁你哋好多時都聽到有啲人要去照 CT 啊，咁到底係點樣照法咧？到底係點搞嘅咧？咁而家咧佢係解釋俾大家聽啦。咁咧原來咧就係裏邊咧就有個 照相機嗰個其實未照相機嚟嘅，佢會打啲 photon 打啲 X 光出嚟嘅，咁咧由一邊打咧就一邊收啦，好似正話嗰幅圖片咁啊，喺另外一地咧就有啲 X 光片嗰度，咁啊一邊咧就射啲 photon 過嚟，一邊嗰邊就收，咁咧佢一路轉啊，咁你咪得到一個360度嘅概念咯，係咪啊？咁而且嗰個佢唔止係一路轉，佢仲係一直咁樣行嘅，嗰張床啊會喐嘅，咁所以咧呢個咧就會睇到好多嘅資料啦。咁咧就你陣間咧就會見到嗰啲資料係點樣出嚟㗎啦。
Now this is a piece of salami, and if you didn't cut it, you wouldn't be able to see the inside of it. But when you actually cut it into slices, you can then see all of the little detail of the different materials that are within this. And this is somewhat similar to what a CT scan does. You're able to see inside the body with very exquisite detail.
咁啊，呢個真係好好嘅比例嚟嘅。咁啊 ，Dr. Alex 咧就話嗱，呢條咧就係意大利嘅香腸啊。咁你如果唔切開佢咧，你係睇唔到裏邊嗰度有幾多肥膏啊，或者有啲咩肉喺裏邊噶嘛。但係你切開佢嘅時候咧，你就睇到好多嘢啦，係咪啊？咁咧，如果你唔切開咧，你就淨係睇到出邊嗰度一條香腸就係咁啦。
And of course, we're not doing any cutting at all. This is all done through X-rays.
咁當然啦，我哋唔係話要將個人咁樣切出嚟啦，就係用個 X 光咁樣去切嘅 ，OK？ 所以大家唔使驚。
CT is a lot better at X-ray at finding cancers. This is an X-ray which has a cancer on it, which is almost impossible to see. But this is the same patient and the CT scan, and you can see that's a lung cancer, which on the X-ray we could barely see. So it just shows you how CT is much better at picking up cancers, particularly early cancers than X-ray.
所以大家你哋有時如果係咳啊，或者係覺得身體非常之唔好啊，你就咁去照個 X 光咧，你可能係揾唔到嘢噶啦。佢而家睇到咧就係正話如果你淨係照個 X 光片，你哋正到呢幅咁嘅圖出嚟，呢個平面圖出嚟，睇落去咧都幾正常下噶喎。但係其實咧佢喺中間呢度啊，呢個位咧，佢係裏邊有 lung cancer 喺裏邊嘅，有個肺癌喺裏邊嘅。咁咧直至到切片啊，打橫咁樣切片 ，OK， 即係切片用個 X 光去切片咧，影咗咁嘅圖出嚟嘅時候咧。我哋就睇到嗰個 cancer 個位置喺呢度啦，但係你如果係就咁成幅圖平面咁樣樣咧，就睇唔到嘅。所以呢啲切片嘅圖咧，就係如果佢切片切得密啊咁樣樣咧，就睇到成個肺啊一路咁切落去咧，如果係有肺癌咧，就會容易睇好多。
So let's talk about what lung cancer screening is.
咁而家我哋睇下乜嘢叫做 CT 呢個肺癌篩查啦嚇。
With CT, we're able to see every single part of your body. We're able to see inside the lungs, and we're able to find even small cancers before they start to spread.
如果我哋係做呢個 CT 呢個斷層掃描咧，斷層即係好多層啦，係嘛？如果我哋可以做到呢個掃描咧，如果係有 cancer 咧，我哋大多數都會睇到嘅，因為佢呢個斷層切得好密、好細嘅 ，OK， 每一層係相隔嘅距離非常之短嘅，所以好難走得甩嘅。咁所以咧。如果係有肺癌，就用呢個方法咧就睇到嘅。有其他嘅地方咧都可能有會睇到嘅。
And the main thing we look for is what's called a nodule. Some people call it a spot in the lungs. The lungs are mostly black because they're filled with air, and we're looking for a nodule which is round and more white.
你見到黑色嘅地方咧，嗰啲係空氣嚟嘅。咁咧，如果你見到白色嗰啲咧，就係個人嗰啲纖維啊、組織啊。咁所以咧，如果係佢而家咁樣睇呢個肺部分咧，呢個打橫切片嘅肺部分咧，突然間有嗱呢啲咁嘅血管嚟啦，睇到啦，但係突然間有粒咁嘅嘢咧，咁佢哋就會懷疑呢個就係可能係呢個斑點可能係肺癌啦。
We do lung cancer screening based on one large trial that was done where they compared X-ray and CT, and this was done on smokers. And as was discussed by Dr. Chang, most of the studies we know focus on smoking, but there's underrepresented are people of Asian descent who are non-smokers, unfortunately. But this study looked at smokers who got screening with CT, and they found a 20% reduction in deaths related to lung cancer and a 7% reduction in overall deaths.
呢個咧就係其實喺全國嗰度，點解會用呢個CT 去查咧？就係因為佢哋做咗一個好大嘅研究啊！呢個好大嘅研究咧，就係去篩查嗰啲食煙嗰啲人士嘅，唔係冇食煙嘅人士，係要淨係篩查食煙嘅人士。佢哋發覺咧喺食煙嘅人士之中咧，如果係做呢個 CT scan 咧，係做呢個 CT 嘅掃描咧，係會揾多個唔做 CT scan 出嚟嘅肺癌患咗肺癌嘅人咯。咁所以咧，佢就係話，因為可以揾到呢啲嘅人出嚟咧，所以咧就可以同佢哋治療啦，然後咧就可以將佢哋死亡率降低啦，就會降低到成5個之中咧會降低1個嘅死亡率嘅。咁呢個即係可以救人咯，救人一命咯，係咪啊？咁咧就將整體嘅死亡率咧可以降低咗即係7%嘅。呢個咧就每年係做3次呢個CT 檢查。
So who should get lung cancer screening?
咁到底邊個人先應該做呢個 CT scan 咧嚇
？So as I said, right now, lung cancer screening is primarily done for people who are smokers. And I think we need more information about people who are non-smokers and whether they should also get screening. But right now, it's mainly people who are smokers and have smoked quite a bit, who are current smokers or quit in the past 15 years, are generally older, 50 to 80 years old, and don't have any symptoms of lung cancer.
做呢個 CT 嘅檢查咧，要錢噶嘛，係咪？咁所以咧就唔係個個都可以做嘅，因為啲驗收公司唔包啊。咁佢話佢包邊啲咧？就係呢啲啦。如果你每一年食多過20包煙，一年食多過20包煙咧，大概咧就係每日食多過1支煙。OK， 即係要你每日食多過1支煙嘅人，或者即係你係以前啦嚇，或者你而家咧都仲係食緊煙嘅，或者咧你喺15年之內係戒咗煙嘅，即係你如果15年之外戒咗煙多過15年咧，就可能冇咩呢個肺癌嘅風險減低咗好多嘅。又如果你係50至80歲之間，或者你咧甚至你係冇呢個其他嘅症狀嘅肺癌嘅症狀嘅。即係譬如嘔血啊，身體嘅磅重減輕啊，個心口痛啊。如果你完全冇呢啲咁嘅症狀嘅咧，唔係任何一個係全部。你如果係全部啱晒呢個咁嘅標準嘅咧，咁你就可以去叫你嘅醫生寫紙，俾你去做呢個 CT scan， 呢個斷層掃描。咁然後咧嗰啲驗疏就會包你啦。
So we know the main advantage of CT scan is to find cancers early, ideally before they have spread, where they're more treatable. But there are some negatives of screening which people should be aware of before they get screening.
咁雖然我哋知道做呢個 CT 嘅掃描有咩好處，但係佢都可能有啲壞處嘅喎。咁到底係咩咧？
These are so radiation, cost, false positive, and unnecessary procedures. I'm going to go through most of these actually.
OK， 咁呢啲咧就係大概嚟講咧，就係總共嘅主要嘅負面影響啦。咁佢會逐個講嘅。
Radiation is something people are very concerned about, but I hope to make you a little bit more comfortable. By living and breathing and walking around, we all get a certain amount of radiation every year. It's measured in MSV or millisieverts. So every year, we all get 3 millisieverts of radiation. Chest CT, a low-dose chest CT from lung cancer screening is 0.7 millisieverts. So it's essentially equivalent to 2 or 3 months of the radiation we get from the environment.
咁所以咧就呢個咧係我哋好多人都好擔心啦。哇！你叫我去照呢啲咁嘅 CT 嘅掃描，咁我咪好多呢啲嘅輻射咯。咁我驚住即係嗰啲輻射可能輻射自己都會致癌噶嘛，多得滯係咪？咁所以咧就有可能人咧就唔想去做嘅。咁呢幅圖咧就係話俾你聽。你其實你去唔去照，你都會有呢個輻射嘅影響噶啦。每一年咧，佢話咧，呢個就係輻射嘅劑量即係嗰啲幾多劑咁啦嚇。咁呢個咧就係每年咧，你就算咩都唔做，你就咁係喺屋企嗰度或者平時咁出街照常平時嘅生活咧，你都會得到3.0呢個咁嘅輻射嘅。但係你如果係做呢個低劑量嘅胸部 CT 咧，你只係0.7嘅啫，即係大概係。呢個1年啊嘛，咁你即係大概係得到3個月左右嘅輻射嘅劑量嘅啫，咁所以其實咧就係非常之少嘅。 你就算係即係做呢個 CT 嘅 scan 都唔使咁驚。
One of the main problems is false positives. We find many spots in the lung. The majority of those are not cancer. There's something else. And that's called a false positive, where we find a spot that doesn't turn out to be cancer. The majority of spots we find are not cancer, and only about 4%. Luckily, most of those patients just get a CT follow-up, and very few actually get biopsy or surgery or other invasive procedures.
咁所以大家咧就可能會有咁嘅經驗啦。如果你去照，可能有啲症狀啦嚇，咁你於是咧就去揾個醫生話我可唔可以去照下個 CT 啊？咁個醫生話好，你去做啊咁。咁於是咧佢去做啦，咁做咗翻嚟之後咧弊啦，原來有個斑點喎，有見到一個結節喺嗰度，即係一粒嘢。咁咧，於是咧原來睇到咧有2/7嘅呢個去照 CT 咧，有2/7嘅人啊係有斑點嘅，但係咧其實呢啲斑點之中咧就只係有100個之中只係有4個真係會係 cancer 嘅啫，即係會係癌症嘅啫。咁所以咧變咗咪好多人咪變咗虛驚一場咯，咁啊好驚噶嘛。咁於是咧，但係佢Dr. Erica 咧就話唔使咁驚，因為主要嚟講咧，我哋就算係見到有一點咧。當然都要睇嗰個點嘅大細啦，係嘛？咁咧，主要嚟講，佢都可能話叫你每一年去做多一個呢個CT 嘅檢查，就睇下呢一點有冇繼續發大啊咁樣，因為太多人個肺嗰度有斑點啦。咁咧就其實只係喺嗰啲有斑點嘅人之中咧，10個之中咧，只係有1個咧係會叫你可能係即係太過。懷疑可能真係肺癌咯，所以咧就會叫你去做呢個活檢或者係做呢個手術嘅，所以唔係話個個都會話有咗斑點咧就即刻去做活檢嘅。活檢即係要拮支針入去，或者有切開少少咁，然後攞啲個肺嘅組織出嚟去查你係咪嗰啲係咪肺癌嘅細胞咯，咁就唔係個個都咁做嘅。
CT scan can't say this nodule is definitively cancer.And this nodule is definitively not cancer. But we're quite good at saying this one we're worried about and this one we think is probably benign. And I'll talk in a second about the different features we look at and then we'll be finished.
So 咁咧，呢啲而家啲醫生咧，因為佢哋做得多咧，佢哋大概咧，佢又唔可以話完全100% 肯定話，呢啲咁嘅粒唔使驚嘅，或者呢啲咁嘅粒，哇呢個似啲喎，即係佢哋大概可以做一個估計，但係佢哋咧就唔會話100%即係好肯定咁樣講話係唔係肺癌嘅，由個 CT 嗰啲照片嗰度啊。咁所以咧，但係咧，佢哋係嘅經驗之中咧，佢哋係可以大概知道咧邊啲係可能會係肺癌，邊啲唔係。
There are 4 main causes of lung nodules: a granuloma, which is usually due to prior infection, a hamartoma, which is a benign lung tumor, a lung cancer, or a metastasis where it's a tumor spread from somewhere else. 2 of those are benign and 2 of those are cancer.
咁咧，呢個咧就係佢哋喺個睇嗰個照片嗰度咧，嗰個 CT 圖嗰度咧，佢哋通常咧就會睇到啲嘢出嚟嘅，睇到個粒嘢個樣啊。咁咧由嗰個樣嗰度咧睇到，多數都係呢個肉芽腫喎，或者係啲錯構嘅瘤喎。咁呢啲咧就係由以前咧可能係有個感染啊，受過感染，譬如我哋好多人以前或者都有個肺癆噶嘛，肺癆之後咧咁個肺裏邊咧係有啲疤痕啊，一粒粒嗰啲咁嘅嘢喺個肺裏邊嘅，咁呢啲咧就係以前遺留低嘅嗰啲感染嘅痕跡嚟嘅，咁咧嗰啲咧就唔係肺癌嚟嘅。咁但係如果肺癌咧，亦都可以睇到嘅，佢咧就係可能就係肺癌啦，或者係移植咗個肺癌喺個 CT 嗰度都可以睇到出嚟嘅，嗰啲就係惡性嘅腫瘤啦。
And a radiologist uses a variety of different features to try to distinguish ones that are cancer versus not cancer, including size, growth, its borders, density, a whole variety of different things.
呢啲醫生咧，佢哋因為睇得多咧，佢哋咧就識去因佢啊，睇到嗰啲嘢到底係咩？佢哋係睇佢嘅大細啦，同埋睇下佢生得幾快啦，同埋睇下佢有冇自己會縮翻細啦，或者有冇鈣化嘅情況啊，同埋個邊係一個非常之重要嘅原因嚟嘅。佢係岩岩巉巉啊，抑或係圓碌碌嘅咧， 咁同埋咧裏邊咧有冇好似個殼，即係好似個殼中間啊空啊咁樣，咁或者咧係其他 satellite， 即係好似其他搬出去有不同嘅連結係連住搬出去嘅粒粒咁樣，咁所以咧佢哋咁樣睇咧就會考慮到用呢啲嘢嚟到考慮嗰個係咪真係肺癌咧？可能係真係要查多啲，可能要做活檢啊，咁所以即係10個先有1個會做啊嘛。
So hopefully we answered all these questions, and thank you for your time, and we're happy to answer any additional questions that you have. Thank you.
Thank you so much, Dr. Elliker. It's wonderful. 咁咧就係今日咧就 Dr. Elliker 咧就同你簡單咁講咗一個最重要查肺癌篩查嘅方法，就係做呢個低劑量嘅 CT 嘅掃描。
Thank you very much, Dr. Chang, Dr. Elliker, for those excellent presentations. You've stirred up quite a few questions here in the Q&A, and so we'll just go through some of them. I might direct some of them to you, Dr. Chang, and others to Dr. Elliker. There are also some clinical ones that I'm happy to tackle as well. I guess I'll direct the first one to Dr. Elliker. Mr. Liu wonders that in the past, there was free mobile tuberculosis screening with chest x-rays, and of course that found some incidental findings. So if we continue to have TB screening with chest x-rays, wouldn't you find more cases of lung cancer?
有一位聽眾嘅 Ray 咧，佢咧就話以前咧就有一啲車咧就係裏邊咧就係有個可以同人照 X 光嘅，咁咧呢啲流動車咧就會周圍咁樣同人照 X 光咧就會查到你有冇肺癆嘅。咁佢話如果係做多啲呢啲咁啊，會唔會係查到肺癆之餘啊，都可能耐唔耐都會可能查到肺癌咧咁。
As I said before, I think chest x-rays are actually been shown not to be very good at picking up lung cancers. In my life, I've read a lot of TB chest x-rays, and I think the number of lung cancers I've found on those is quite a small number. So I doubt we would pick up a lot more lung cancers, and this is why CT is so much better.
咁正話 Dr. Elliker， 如果你記得佢講過啲咩嘢咧，就係佢俾咗張 X 光嘅片，然後話俾你聽點樣係睇唔到啊嘛，即係你就算係有粒肺癌喺正，尤其是喺正中間嗰啲位啊，俾嗰啲白色嗰啲嘢遮住晒嘅話咧，咁你係睇唔到嘅。咁所以佢話咧喺佢嘅做呢個放射醫生嘅生涯之中咧，佢話其實係好少曾經係可以用呢個照呢個肺片啊，照 X 光啊，係可以睇到係有肺癌咯。即係大部分都係要用呢個做 CT。呢個先至可以睇到咯。
Thank you, Dr. Elliker. Dr. Chang, this next question is for you and it relates to family risk of lung cancer. So Ms. Kwong would like to know, her mother was a non-smoker and unfortunately died from lung cancer. Are she and her siblings at high risk for getting lung cancer?
咁呢個咧就係話，有位鄺小姐咧就問，如果佢媽媽係曾經係有過肺癌，但係咧亦都係一個從不吸煙嘅女性，咁佢哋嗰啲即係細路仔啊、兄弟姊妹啊，咁會唔會有呢個增加肺癌嘅機會係高咧
？So we do know that family history of lung cancer is a risk factor. It does increase the chances for developing lung cancer. I think that's important when you're talking to your physician and your physician is asking about history of prior cancers in your family, to inform your physician to let them know that that you do have a family history of lung cancer.
咁鄭醫生鄭博士咧就係話係嘅，因為呢個有家族歷史係有呢個肺癌咧，係會尤其是係唔食煙嗰啲肺癌啊，係會影響嗰個以後嗰個肺癌嘅機率嘅。所以咧，你如果係擔心咧，你就應該睇醫生嘅時候咧，同你嘅醫生提出嚟話俾佢聽，你話我有個家族歷史，我媽媽係肺癌死嘅，而佢係從來未食過煙，但係佢係肺癌死嘅，你應該話俾佢聽。咁或者咧，佢會留意啲你喺某一個情形嘅時候咧，就可能叫你去做呢個肺癌檢查。Surprisingly, family history is not one of the criteria for the low-dose CT scan, Dr. Elliker.
Yes, that is correct. And that's an unfortunate side effect of the studies have focused mainly on smokers. But I definitely think, and hopefully in the future, there will be more information that comes about people with genetic predispositions to developing lung cancers.
Thank you. So 但係咧呢個家族遺傳歷史呢樣嘢咧，雖然係會增加呢個肺癌機會，但係好可惜咧，就係喺呢個做呢個 CT 檢查嘅必要嘅，即係使唔使做嘅時候咧，佢係冇計落去嘅，因為佢哋去做嗰個研究嘅時候咧，係冇將呢樣嘢擺咗入去，所以佢哋就算係咧，佢都唔可以話你咁樣係可以去做呢個 CT scan， 咁呢個係不幸之處。
Thank you very much, Dr. Eliker. So, Dr. Chang, another question for you. The next several are for you. Mr. Liu had a brother-in-law die of stage 4 pleural effusion, presumably lung cancer, and he was exposed to strong bleach agents that he used daily to clean the bathroom. Is that a known risk factor for the development of lung cancer?
咁咧就係另外一位又係 Ray 啦嚇。咁佢嘅太太嘅兄弟啦，係嘛？咁咧就曾經咧，亦都係因為個肺水而死嘅。咁佢懷疑呢個肺水脹咧，肺水腫咧，就可能係因為有呢個第4期肺癌而形成嘅。咁但係咧，佢話咧，呢位親戚咧，就係好多時咧就用呢個漂白水啊去做嘢嘅。咁所以佢話咁漂白水係咪會影響到個肺，可能會增加肺癌嘅風險咧？就係呢條問題問阿鄭博士嘅。
Specifically, I don't think there's been studies that look specifically at bleach in terms of that potentially being a risk factor, but I think there have been studies that, certain occupations that could have exposure to some of the chemicals that we know that are involved in being a risk factor for lung cancer, such as benzene, arsenic, asbestos, have been associated with an increased risk of lung cancer. In regards to the genetic component, we do know that there are genetic susceptibility and predisposition genes that do play a role. And I think we're learning more and more about how inherited susceptibility increases the risk of lung cancer.
咁個答案就係唔知，因為咧就我哋知道咧喺環境嘅化學品之中咧係有啲係會造成增加呢個肺癌嘅風險嘅，譬如係石棉啦，係咪？正話你睇過嗰啲圖都睇到啦。咁咧，但係咧呢個漂白劑呢樣嘢咧就冇做到喎，咁所以咧就係答案係唔知嘅。但係如果係可能個家族嘅遺傳啊，嗰個遺傳嘅基因啊，可能對某一啲嘅化學藥品咧係特別敏感啊，而有呢個化學作用咧。所以大家都即係唔係話個個人都可能會有嘅，就可能係你自己嘅身體嘅本質啊，個遺傳個基因嘅本質，而又加上呢個環境嘅啱啱又碰到啲乜咁樣咧，就可能有一個作用出嚟咧，就可能影響肺炎。咁呢樣嘢真係個研究未做到嘅，所以我哋而家做呢啲研究真係好初步咯。但係咧初步都好就係一個好嘅開始嚟嘅。
Thank you very much. The next two I'll combine. So we have a question from Mr. Fong and Mr. Liu. And this is for Dr. Chang. They're actually wondering whether there's a connection between either working or eating in restaurants and cooking oil fumes and unventilated smoke. Are either of those or both a risk factor for the development of lung cancer?
呢個咧就係問食嘢嘅問題啊，話我哋去餐室食嘢啊，成日出街食嘢啊，咁個餐室嘅廚房嗰啲油煙啦，或者我哋自己唔出餐室食嘢，喺屋企嗰度煮，用個煤氣爐煮嘢食，或者用嗰啲propane 嗰啲爐去燒嘢食啊，咁樣啦，咁會唔會增加呢個肺癌嘅風險？So
what we know in regards to restaurant workers and lung cancer risk, I think it's also important to think about the studies. And those studies earlier were really conducted when there was a lot of secondhand smoke, right? So this is when there was a lot of smoking also that was occurring in restaurants. So that's where some of the evidence we're showing in terms of restaurant workers exposed to secondhand smoke and developing lung cancer risk. We do know from a lot of studies that have been conducted, most of them in Asia, where exposure to cooking at really high temperatures in a wok that makes a lot of cooking oil fumes. There's chemicals that happen in being poor ventilated areas, and that has shown through the literature that exposure to that cooking oil fumes to be a risk factor for lung cancer. So that's the importance of having really good ventilation. I think we're going to be looking at this specifically in our study, and, think about some of the questions that have been asked in the past. When you cook, is there a lot of smoke? Is there irritation? Are you constantly cooking in such a way where you're having a lot of that cooking oil exposure? And I love Asian cooking. I love the searing and the cooking on the high temperatures. But I think having really good important ventilation is important.
咁咧就係簡單嚟講就係我哋中國人咧最緊要食嘢係講咩？鑊氣啊嘛，係嘛？鑊氣點樣嚟㗎？就係將嗰啲鑊咧燒到好熱好熱好熱，然後加啲油落去，咁啊喳一聲咁嗰啲煙咧就飛晒出嚟咁咧，咁咧就好嗰啲餸炒出嚟咧就好夠鑊氣啦，非常之好食。但係咧就可能會對健康冇咁好咯，係咪？因為嗰啲係燒咗嘅油，佢個化學個本身咧個質地咧就變咗噶啦。咁你吸咗入去咧，咁咧佢話咧呢個咧喺呢度咧就一路咧都冇咩做研究嘅，去餐室食嘢咧，通常咧就係話吸二手煙啊，因為以前餐室嗰度你係可以食煙噶嘛，好多人去到就係哇又食煙啦，又飲酒啦，大家又傾偈啦，咁好開心噶嘛，係嘛？咁啊當然而家咧情況就變咗咧，最近一兩個世紀啦，就變咗咧，就係話喺餐室喺公眾嘅地方咧就唔准你吸煙啊嘛。咁呢啲係好嘅改變，但係當時都好多人唔中意咯。但係好啦，而家咧就喺餐室食嘢咧，你就唔使擔心會食到二手煙，因為嗰啲人咧就唔准喺餐室嗰度食煙嘅。咁所以咧，你話如果喺餐室裏邊做嘢嗰啲人會唔會增加風險，有呢個肺癌風險咧？就而家咧真係唔知嘅，喺美國嚟講。但係佢話喺東南亞嗰度咧，就有啲研究啊，就有一啲餐室咧就專係嗰啲鑊氣好高好靚嘅嗰啲地方咧，我發覺可能真係嗰啲人嘅肺癌風險可能增加咗喎。咁所以咧呢個研究咧就係喺東南亞嗰度做啦，就唔係呢度做啦，所以都可能都即係你唔可以話嗰度有呢度有係咁嘅，係嘛？咁所以咧我哋而家暫時嘅答案咧就係唔知，但係咧應該有懷疑嘅態度。如果盡量可以通風，開個抽氣機，唔好企到個鑊咁埋，唔好整到佢咁熱，或者食少啲鑊氣嘅嘢啦，用就一就嘅口味啦，係嘛？咁咧可能咧就我哋嘅肺癌風險咧可能係會減少啲嘅。
The next question is more clinical for people who have bronchiectasis. Is that related to an increased risk of lung cancer?
I'm not sure if Dr. Kratz could help me with this. I mean, there has been a link with prior lung conditions in relationship to developing lung cancer, such as chronic obstructive pulmonary disease, COPD. I'm not familiar specifically with bronchitis. I'm not sure if Dr. Kratz could do that.
So the question is, for those who have bronchiectasis, which is a chronic infection of the lungs leading to collapse and coalescing or bunching of the airways together, resulting in diseased and fibrotic lung, is that a risk factor for the development of lung cancer?
咁咧，其中一條問題咧就係話，如果個肺裏邊啊成日都發炎咧，呢啲情況咧就係好多時吸煙重嘅人咧，係好多時個肺裏邊有發炎嘅，就係嗰啲肺嗰啲組織啊、嗰啲支氣管啊咁喺裏邊有啲痰啊諸如此類咁咧就發炎，咁發炎咗之後咧就變咗成一嚿咁樣。佢話如果有呢啲人有呢啲咁嘅嘢咧，會唔會多咗增加咗呢個肺炎嘅機會？咁阿鄭博士咧就係話而家咧就冇人提過話有呢種咁嘅發炎嘅嘢嘅情況咧，係有增加肺炎嘅機會，並唔係話冇啊，只係我哋而家唔知，即係未有人去做呢個調查，所以大家要分清楚個答案嚇。冇同唔知咧係兩回事嚟嘅。
The answer is yes, there is that is a risk factor for the development of lung cancer. Anywhere between 2 and 3-fold higher chance of developing lung cancer if you have bronchiectasis. And Dr. Chang noted that this is similar to other chronic lung conditions like chronic obstructive pulmonary disease or pulmonary fibrosis.
咁貴醫生咧就因為佢係手術醫生啦，咁佢咧就係見過呢種情況咧，佢話咧其實你個肺嗰度如果係有呢啲咁嘅情況啊，係成日發炎係因為有痰啊，而嗰啲肺裏邊嘅組織啊係走埋一嚿啊咁樣啦。佢話係會增加嗰個肺癌嘅風險嘅，增加啦。Is it 2 to 3-fold? Do you say?
Yes.
增加2-3倍嘅風險嘅，所以 如果係各位個肺嗰度成日有發炎啊咁樣，你大家都要留意啲咯。咁就去真係可能要每年或者幾個月咁去做呢個肺嘅 CT 檢查咯。煎炸或烹炸或者煎炒產生嘅油煙係咪影響肺部咧？或者係漸漸形成肺癌？謝謝。應該呢條問題答咗㗎啦喎，係咪？So this is about cooking, about stir fry and maybe deep fry, and then there's the smoke cooking oil coming out, right? So when you use stir fry and so instead of steaming, if you do stir fry and or deep fry, then there's more oil coming out, and then the question is asking, is it going to affect the lungs? And in the long run, would it then cause lung cancer?
So I think there has been specifically looking at rapeseed oil, which I think is a common type of cooking oil that is used, and that in terms of cooking that at a high temperature has been linked with lung cancer risk. I think I also want to comment also in terms of cooking and what some of the evidence in terms of that we've seen is another aspect of cooking is also knowing, when we cook like meat and we get like the char on the meat, that also includes what we call heterocyclic amines, so some that have been linked to lung cancer. So that's also something I think to be aware of. I think we also like the char on meat that happens when cooking, but also to know that there has been some studies that have shown that to also be linked.
如果你係用一種油係叫做 grapeseed oil， 即係菩提油啊，菩提子油啊，咁咧佢話咧呢個如果你係將佢整到啲油好熱嘅話，而冒煙嘅話咧，佢話吸咗呢啲咁嘅煙咧，佢話曾經係有研究話呢啲咁嘅煙咧係可以致肺癌嘅。咁大家如果係咁嘅就唔好買嗰種油咯，即係唔係種種油都會令到你致肺癌噶嘛。咁啊，即係兩樣嘢，一係你咧揀油，第二咧就唔好整到佢咁熱，係咪啊？咁咧就鄭醫生咧就講到一樣嘢咧，就係話我哋好多時咧食嘢咧中意燶燶地噶嘛。就算你去私立鋪買啊啲叉燒啊燒肉，有時佢都燒燶咗噶嘛，咁就叫佢切咗出嚟啦，燶嗰啲人唔好要啦，真係噶。咁你如果唔係話食咗燶嗰啲咧，你成日食燶嗰啲嘢咧，因為燶嗰部分咧就係嗰啲肉類啊，已經係變咗質，所以佢變咗黑色，就係因為佢燒燶咗。咁嗰啲肉類嗰裏邊嗰啲蛋白質咧已經係變咗質噶啦。咁你食啲咁嘅變質嘅蛋白質咧，你食得多咧係會增加呢個癌症嘅風險嘅。咁啊呢個就唔係肺癌啦，即係可能係其他嘅癌症啦，係咪？咁所以大家如果你係中意去燒嘢食啊，或者你用焗爐去焗嘢啊，咁即係都唔好整到佢燶晒咯。如果燶都即係燶嘅，你咪切咗燶嗰啲出嚟，就唔好食嗰部分。即係大家可能要小心啲啦，因為你話實際嘅證據話呢啲一定致癌嘅，我哋就係冇嘅。但係我哋真係好多呢啲咁嘅懷疑咧，就而家未有真實嘅證據之前咧，大家小心啲，咁就減低一啲致癌嘅風險，都係應該一個健康之道嚟嘅嚇。
So the question is, my mother has sputum cough in the morning, and the sputum is red, like rust colored. Do we need to worry about it?
呢個咧就係話佢媽媽朝頭早咧就成日咳嘅，咳出嚟嗰啲痰啊，係好似生鏽嗰啲紅色咁，即係深紅色啦。佢話使唔使擔心啊咁？So
the answer is that rust-colored sputum can be associated with a number of different conditions, including chronic lung disease like COPD, but it can also be associated with TB and or lung cancer. So that would be a reason to have your primary care physician examine your mother and check her out.
貴醫生咧就係話呢啲咁嘅吐出嚟嘅痰啊，如果係有啲深紅色，好似生鏽咁樣色咧，呢個應該係要去睇醫生噶啦。呢個無論點樣睇啊，都可能係一啲嚴重嘅情況嚟嘅，可能係肺癆啊、肺癌啊，或者係有其他啲肺腫脹嘅現狀啊，咁即係都係應該受到醫療嘅幫助咯。
We have time for a couple more questions, and so Mr. Fong notes that this is a question both for Dr. Chang, Dr. Elliker. There's been an increase in lung cancer, actually doubling in young female I don't know if he meant to say never smokers or smokers in the last 10 years who would not meet the current screening criteria. I believe he meant to say never smokers. So how do we address, the lung cancer incidence in young female never smokers, and how can we possibly change the screening guidelines to address this?
You're right. This is important because, the guidelines that we do have for screening is among those who are more heavier smokers. And at this moment, we don't quite have the information yet to have recommendations in terms of those who never smoke. So I think this is a part of an effort that many investigators are looking into in terms of using the information we have to see if we can develop more predictive models in terms of trying to understand how we can provide information and guidelines in regards to screening among those women or men who don't smoke. But unfortunately, we don't have the data at hand at this moment, but this is an effort that many are working on.
咁方先生咧，呢個係一個非常之好嘅問題嚟嘅。呢個就係而家呢啲研究員咧，做研究呢啲博士咧，就係都係處心積慮喺度做緊嘅，希望揾到啲有力嘅證據出嚟，係可以叫政府啊，或者係叫嗰啲驗收公司咧，係會俾呢啲人去驗呢個CT 嘅掃描，咁樣咧就會早啲發現係咪有肺癌咁樣。但係至而家嚟為止咧，我哋係未曾有足夠嘅資料啊，去叫呢個政府或者叫呢啲私人嘅保險公司咧去做呢樣嘢。所以睇到係有咁嘅情況，但係咧睇到嘅情況之餘咧，咁你都係要等佢哋早啲去做到篩查，然後先至咩嘅篩查。其實簡單嚟講都係錢嘅問題嘅啫。就算係驗所唔俾你有咁嘅懷疑，自己屋企嗰度有啲咁嘅情況，你係有懷疑嘅，咁你咪可以叫嗰啲人去做咯，就最多都係自己俾錢咯。咁UCSF 又有得做啦，就甚至東華醫院都有得做嘅，咁你咪自己去睇下邊度係就腳嘅方便嘅，你咪叫個醫生同你寫張紙，你話我好擔心有肺炎啊，因為某種原因，咁佢咪會寫張紙俾你去做呢個篩查咯，做到翻嚟嘅時候咁咪可以知道係咩咯。但係記住做呢個篩查咧，唔係話做一次就算嘅喎。如果你做開呢個咁嘅篩查，你有咁嘅懷疑咧，你真係要可能都每年要做一次啊，1-2年要做一次啊咁咯。除非係個環境改變咗，你再冇咁嘅憂慮啦，係咪？
And Dr. Elliker, I'm just going to ask on or add on to that question. So there are a couple of questions asked in the Q&A about expanding the lung cancer screening guidelines and criteria. How, in light of all the discoveries that, for example, Dr. Chang is making and others are making, how do we expand the criteria for lung cancer screening?
咁就係佢而家問啊 Dr. Elliker 就係話有咁嘅情形，就喺佢哋呢啲專家放射專家之中有冇辦法可以叫嗰啲政府啊醫療機構啊去包埋呢啲咁嘅人去做呢啲CT 嘅篩查咯。
So I guess what I would say about that is that it's really hard to prove that lung cancer screening works. It takes the study that we quote was over 53,000 patients who got 3 CTs. So it's not easy to actually show that these things work. And it takes a lot of money and effort to do so. And there are negatives to screening. So we want to make sure that the benefits of detecting this number of lung cancers outweigh the risks of doing the screening. And that's difficult to prove. And so we have a lot of work to do.
咁Dr. Elliker 咧就話我哋仲有好多工作要做咯，因為就算係初開始佢哋係可以包去俾錢呢個CT screening 嘅時候嘅 CT 篩查嘅時候，佢哋係用咗53,000個人，而呢53,000個人咧係每一年要做3次呢個 CT 嘅篩查，然後先至揾到一個number 出嚟係話我哋係可以幫到減到呢個死亡率啊，或者可以幫到揾到5個人之中有一個咁係有呢個肺癌啊咁，佢哋係要用咁多嘅人咁多嘅資歷去做咁多嘅篩查，然後先有呢啲咁嘅證據。佢話所以如果係而家我哋想話加埋一啲嗰啲冇吸煙嘅人要咁樣做咧，咁你人數嗰方面咧就已經大打折扣啦。去邊度揾53,000人咧？而呢啲人 要每個人要做一年要做3次，咁即係好多錢，你呢啲錢，咁一定要係政府俾錢先可以做啦。咁所以你如果係冇錢做呢啲研究咧，你根本係永遠都唔會做到呢個研究，而冇呢個咁嘅證據咧，去叫佢哋去包呢啲咁嘅篩查嘅。所以佢係一個非常困難嘅事，唔係做唔得，不過係困難咯。So I see that Dr. Elika is typing some answers to Ronnie to address his question about the AI, if AI could be used. I want to know the answer too. So
well, I can't quit. I don't know if you'll quickly. It's AI is so far AI is not as good as radiologists, so I still have a job, thankfully. Maybe in the future it will be better than us, but not quite yet.
That's just like you'll learn next week, robotic surgery still requires a surgeon. So I still have a job as well.
Yeah, I saw that slide. So AI, the robotic and the AI stuff is not going to take over our expert physicians. Thank you. That's good to know. I want to remind everyone that there are some resources here. If you want to join the listserv, please write to ahi.ucsf@gmail.com and then just add my email to listserv. And that we do have a website and it's called ahi.ucsf.edu and it's a bilingual website and there's a ton of information in there about a lot of things, including all the classes that we did and the town halls and so on. We also have a Facebook that you can follow us at UCSF AHI. And then we have YouTube channels with many of the YouTubes that we posted, including town halls like this. So we have done over 40 town halls since the beginning of the pandemic. And so we didn't do town halls before. We were doing classes in person. So, but since the pandemic, since April of 2020, we've been doing town halls. And we have over 40 of them posted in the YouTube channel. So please go there and please like us and please follow us. That way, if you follow us, when we post a new YouTube presentation, you will get notified. So we thank you for all the busy physicians who came here today to explain things so that we can get a better understanding of lung cancer and the screening and learn about what's going on. And we also want to thank the production team. And we added 2 people, Longan Pham and John O'Mahony. And so they came to help us with organizing the symposium and helping with the Q&A. And of course, on a regular basis, we have Clifford and Sandy and Raymond helping us with all these town halls. Thank you so much, everyone. And then of course, we want to thank you for joining us. 咁多謝各位一齊參加。咁我哋多謝所有幫我哋嘅人同埋呢啲演講嘅人咧，我哋多謝各位參加嘅。咁我哋祝大家健康同埋請你保重。Thank you. Until next week, we will see you again. Bye bye.
Thank you.
Bye. Thank you.
Bye bye.
Thank you.